We're using a manual toothbrush. I'll show you that first, then we'll act like this is an electric, okay? So this is a manual toothbrush, which you'll do in the morning, okay? So with this, you want to go ahead, the proper way is to jiggle and swish. Jiggle and swish. Taking that type of time every day, most people don't want to do that. So the second best thing is just to do in full circles gently, okay? Now, once you've done this, if you feel like you want to do some brushing down, that's fine. You can do that too, okay? Never do this. You'll end up causing recession. Your gum line won't like pain, and it'll move away from pain.
Okay.
And the same on the bottom. When you're doing this, the gums will move down. So you don't ever want to scrub your teeth, okay? So you want to either do jiggle and swish on the bottom, jiggle and swish up, jiggle and swish up.
Okay.
Like I said, it's very tedious, but so this would be your second best choice, would be to be big circles. Very gentle though, okay? Bacteria is soft, so you don't need to be hard. Always use an extra soft or soft toothbrush, okay? Never a medium or a hard.
Okay.
I know they make them, but it's not for your teeth, okay? If you had an electric toothbrush, it's a placement brush. So what you do is you place it under the gum line, and you 45 degrees, and then you just gently move it all the way across your teeth. And you can do it back if you want to also. Now, it's going to jiggle the roots of your teeth and push, there's fluid underneath there, it's called clavicular fluid. It's going to push it 31,000 strokes. It's going to jiggle it back and forth. It's going to move the roots, knock everything off your teeth. So it's very helpful under the gum line and above the gum line. And so on the bottom teeth, if you're using electric, the same thing, you just angle it 45 degrees and you move it. And on the inside with the electric, you can go back and forth, okay, on the inside and where you occlude.
Okay.
Just on the front, you want to angle it 45 degrees and move it. Okay, it's a placement brush in the front, okay? I would recommend it, if you have choices, use it on the lowest speed, the most gentle speed you can in the front. If you want to move it up one notch on the inside, especially if you have a retainer or you build up a lot back there, you can put it on the next one. It might be considered medium, and that's fine where you occlude. Okay, but never on the front. Keep it on low. Okay, I just keep it on low in my entire mouth.
Okay.
Because, like I said, bacteria is soft if you catch it within 3 to 7 days. It's not going to get hard anyway, and so you're not brushing to get your teeth whiter. Okay, you're brushing to get the bacteria off your teeth so it doesn't get calcified and turn into calculus, which is damaging.
So is it okay if I don't floss if I'm using the electrical toothbrush?
Okay, so the electric toothbrush, that's a good question. It doesn't replace the floss because the floss goes 3 millimeters under the gum line, and so when you're bringing it out, you're pulling the bad bacteria out. So when you're going under and bringing it out, you're pulling out the bad bacteria, and then you go under and pull it out. Even though the clavicular fluid is moving the roots of your teeth, it's knocking everything out above the teeth, okay? So you still have to go under the gums and pull out the bad bacteria. It doesn't replace it. So those are just the best two things, is the thick floss, round, the waxed, and then the electric toothbrush. Okay, those are most, you don't need a water pick or any extra things. You don't have braces and you're not a smoker, and so those are the basics that you need. If you stay thorough and use those every day, you won't fall into any bacterial infection.